We continue our 7-week health campaign this week, focusing on breast cancer and the ways it can be treated. Many of you know I was diagnosed with breast cancer last year, had surgery, and am now, I'm told, cancer-free. So what next? What does one do to remain a survivor? I explore that issue with a few of my expert friends. 3 months after my last surgery, I'm back to work and finally back to the gym. Both Dr. Wayne Lee, my plastic surgeon, and Dr. Charles Cox, my breast surgeon, told me exercise is important, especially for someone like me who had an estrogen-positive cancer. Estrogen fueled my cancer, and exercise may help keep estrogen levels down.
Generally speaking, healing takes about 4 to 6 weeks. This is the initial healing, where your maximum wound healing strength only gets to about 50% by about 4 weeks. When you're a year out from surgery, maximum wound strength only gets up to about 80%. So I generally tell patients that for the first 4 to 6 weeks, take it easy. You can do walking, range of motion exercises.
Hard for me, a hardcore gym junkie. I'd exercise every day for at least an hour if I had the time, or the okay from my doc. But now I have to be patient with my healing body. I'm lucky enough to be able to work out with a personal trainer. Bo Talifer worked with me before my diagnosis and was anxious to help me regain strength after my surgery. He was also kind enough to actually talk one-on-one with my plastic surgeon about what I should not be doing this first year, or perhaps ever again.
We have a lot of newer technologies. We're able to save the nipple and save the skin, so the cosmetic results can mirror those from breast augmentation. However, sometimes we use expanders that expand the pectoralis major muscle. It does make them a little weaker and thinner, so its strength is weakened.
The implant is underneath your muscle tissue, and he doesn't want that skin and the muscle to thin out too much, especially when you do push-ups, chest press, and that tend to happen in cases like that because you don't have the protection of that tissues, of the breast tissues anymore. So we have to be careful of that.
So that means I don't have to do push-ups anymore?
Well, we'll find other ways to torture you, but push-up will not be one of the ways to do that.
It can definitely change the shape. The body naturally forms a scar or a capsule around any foreign object, whether it's an implant or expander. And if the muscle is intimately integrated with that capsule, if it's thin and stretched out, potentially the implant could rupture or the implant could move. We're called being displaced.
Which is why it's important for any breast cancer survivor to know what their new limitations are. If you can't afford a trainer every week, hire one to set up a program just for you. Something that you can do at home for free. The important thing is that exercise of some kind is a key factor to preventing a reoccurrence, as is diet.
It helps with keeping up their strength and energy.
Examples of food that help you through chemo: cold foods and foods with no smells, like fruit, cottage cheese.
Once you're healing and starting to feel better, we recommend going toward a plant-based diet, which is focused on fruits, vegetables, whole grains. We want to aim for 2/3 of our plate from these foods. These foods have more fiber and less calories.
Fruits and veggies, like it or not, also have all sorts of cancer-fighting components, so make sure you get a variety of colors. And should cancer survivors take supplements?
A multivitamin can be okay, but anything else, we want you to discuss it with your physician, because some vitamins, minerals, especially the certain dosage of it, along with herbs and over-the-counter types of supplements, can actually interfere with the treatment and the therapy, making it less effective.
Well, another thing I decided to do was to enroll in a clinical trial at Moffitt Cancer Center, where I learned some stress-relieving methods like yoga and meditation. Most of our cancer centers around here have numerous clinical trials that you can ask about, and all of these things help, according to the medical experts that I've worked with. If you'd like to learn more about a new post-operative return to fitness program for breast cancer survivors, go to my Facebook fan page. Just look for Linda Hurtado, WFTS, under Pages. And Florida cancer specialists will be here tomorrow to answer your calls for our Taking Action Against Breast Cancer phone bank. That's tomorrow at noon, and I hope you'll